Our next speaker is Amanda Hughes from the University of Bristol, who's going to talk to us about the impact of weight stigma on youth and young adults.
Right, hi everyone. Firstly, I just want to say thanks to Lou and Sally for really helping set this up, which is good. It will make the kind of initial explanation a little easier. And this is a presentation about a couple bits of research I've been involved in over the last couple of years from an ESRC project specifically about weight-related stigma. But the things I'm talking about today are the elements that had a southwest of England focus in different ways. Trying to keep the sort of local link. I'm going to go through this first slide very quickly because we've kind of heard about this. Obesity is, despite being common, is very highly stigmatized. This has all these negative effects, both in terms of people's experiences and in terms of health and health-related behaviors. And I say independent because it's important to stress that this is about the stigma rather than the weight. Obviously, they go together. They're separate issues which are affecting health through different pathways. However, even though there's increasing recognition of the importance of weight stigma itself as a public health issue, there's a lot we still don't know about who's most impacted by weight stigma and why, and also how we might be able to intervene to reduce weight stigma and its effects. The kind of background to that is the fact that most of the existing evidence around weight stigma and its effects has been very US focused. And also it's tended to come from small and/or non-representative samples. So what we've been working on over the last couple of years is trying to put more of a UK focus on that with representative data where we can, and see what we see. So the first bit of research was looking at risk factors for internalized weight stigma within young adults. So internalized weight stigma can be defined as agreement with and self-application of negative weight-related stereotypes. So this is when someone starts thinking of yourself as lazy or incompetent, etc. So you're really taking those stereotypes in, and that's affecting your global self-concept. So we know that specifically shows very strong associations with worse mental health, healthcare avoidance, so not going to the doctor when you need to, and disordered eating. What we wanted to know is which factors and experiences, crucially from childhood onwards, predict more internalized weight stigma in adulthood, and specifically after you hold constant people's weight, because it is important to separate those things out. So we had a look in a sample of more than 4,000 children who had been born in the Bristol area around 1991 and have since been followed up annually. And when they were about 30 years old, they completed a scale which captured symptoms, captured internalized weight stigma through, I think it's 11 questions. And so this was great because it meant we could explore associations of internalized weight stigma in adulthood with experiences at different ages, including in childhood, but which were reported at the time. So that's really powerful because you don't get the sort of bias of people remembering things retrospectively more than other things, depending on what happened later. And also, because these kids were followed up throughout their childhood and adolescence and into adulthood, we could also account for BMI at different ages, with all the caveats that BMI is not the best measure in the world, but still, it's useful for starting to separate out these mechanisms. So we did this with the Children of the 90s study, which I'm sure lots of people in the room know and have worked with. And everyone involved was born in these areas around 1991, give or take. So I've kept the numbers and stuff off here because I just wanted to stress kind of the bottom line about what we saw in terms of what looks like it matters. And the first thing we saw is that the social environment in adolescence really seems to matter. We found that after accounting for BMI in adulthood and in adolescence and a bunch of other socioeconomic factors which might be influencing these patterns, we found that there was higher internalized weight stigma in adulthood for people who, when they were 13, reported that they'd been teased about their weight by their family or at school, who had received negative comments about their weight from their parents, who'd felt under pressure to lose weight from family or the media. Yeah, I'm just going to leave that there. And that was, we took into account both how much people's BMI as adults and also when they were 13. So that's not just about how much they weighed when they were 13. Secondly, it looks like bullying matters, interestingly, including among adults. So internalized weight stigma, again, was higher at age 30 for people who had reported that they'd been recently bullied. And this is for any reason, interestingly, not just specifically about their weight, when they were 17, but also when they were 24. So bullying doesn't just happen in schools, it can happen in workplaces, other settings, and maybe that's something we should be thinking about. Thirdly, and this is particularly interesting for me because I mostly work on health inequalities, there are social inequalities in internalized weight stigma, again, even after you take into account social inequalities in people's BMI. So we saw that accounting for BMI in adulthood, earlier in life, and other factors, internalized weight stigma was higher for females compared to males. It was higher for people who had been socioeconomically disadvantaged, either as children or as adults. It was also higher for male and female sexual minorities compared to heterosexual people. So yeah, that's a link to the published paper. The kind of take-home points from this are that adolescents, family, school, and media environments may have long-lasting impacts on internalized weight stigma in adulthood, and that these may be fruitful targets for intervention to reduce internalized weight stigma and its consequences. I think this underscores the importance of talking with children about food and about weight in ways which are not stigmatizing, so not moralizing it. And what we want to do next is look into the psychological processes in more depth that are involved in mediating these relationships. And we have ongoing work. Okay. Very quickly, piece of research with a local focus, part 2. With a couple other people in the room, we wanted to look at how schools respond to 2 minutes weight-related bullying. So very quickly, weight is probably the most common reason for youth bullying. That's not a new finding at all. And in the UK, school bullying policies are an important way that unacceptable behaviour is defined and discouraged. They often explicitly mention specific other kinds or targets of bullying. And we wanted to know how often they mentioned weight-based bullying. So we did an audit targeting all secondary schools in basically the southwest of England, or at least our part of it. And we were able to get data on 97% of the schools we were targeting with a demographic mix. We wanted to know, firstly, if or how school bullying policies mention weight-related bullying. And secondly, if that likelihood differs by school level factors. So we found that. This is where I want you to all guess what % of schools mention weight-related bullying in their policies. Not time for shout-outs, but just have an idea. Almost none of them did. Exactly 17 of them, so less than 7%, mention weight, size, or shape in their policies in relation to bullying. That was 16th behind things like being a carer, pregnancy or maternity, or ageism, which is interesting. Although lots did mention appearance-related bullying, we don't think that's particularly helpful here because it's so general that could be about anything at all. We also found that the likelihood the weight was mentioned varied by school type. So some things didn't make a lot of difference, but private schools were much more likely to mention weight-related bullying in their policies than other schools. No special schools mentioned it, and within mainstream state schools, there was some evidence that free schools more than academies mentioned it. So that's linked to the published work. Essentially, what we think is going on is that schools are very heavily guided by the Equality Act. By this, that's compared to weight. But we need to think about relevance to children. 1 in 3 starting secondary school with obesity. This can make a difference. So ensuring weight is included in school anti-bullying policies could be a simple yet important step towards reducing rates of weight-related bullying. Thank you.